There were 1,043 locally acquired cases of COVID reported in the 24 hours to 8 p.m. last night, and one overseas case. There were 131,668 COVID tests, and we currently have 232 cases in ICU. Of note, we have continued to see a decline in cases in some of the heavily affected local government areas such as Canterbury-Bankstown and Cumberland, but we are seeing increased cases in particularly the Illawarra area. I do want to highlight the fact that we're asking everyone in the Illawarra. We've had 103 new cases reported, bringing the total number of cases to 1,001. The Wollongong local government area is the most impacted, and the Shellharbour local government area. So I am urging everyone to be cautious. Please come forward to get tested, and also please get vaccinated. In terms of sewage detections, we've seen sewage detections in Lightning Ridge, Jindabyne, Crookwell and South Lismore. So as per usual, we just alert the community to those detections. I would want to particularly mention Jindabyne. Jindabyne's got a high level detection, and we often know that those high level detections do correlate with a case in that community. So please, particularly in Jindabyne, come out and get tested. In terms of Cowra, we have seen a number of cases transmit amongst young children, and that we want to thank the Cowra community for coming forward, getting tested and following all of the public health advice. Sadly, we are reporting the deaths of 11 people with COVID, and I just want to also extend my condolences to their loved ones. And I think, again, it shows that we cannot be complacent with COVID, and we need to take all of those precautionary actions and also get vaccinated. A woman in her 80s from Sydney's Inner West died at home. She tested positive after her death. She was not vaccinated, and she was a resident of a social housing complex in Camperdown. There was a woman in her 50s from Western Sydney, died at Nepean Hospital. A man in his 80s from southwestern Sydney died at Liverpool Hospital. A woman in her 80s from Sydney's Inner West died at Sutherland Hospital. A man in his 80s from Sydney's eastern suburbs died at Prince of Wales Hospital. A man in his 60s from southwestern Sydney died at St George Hospital. A woman in her 90s from Western Sydney died at Westmead Hospital. And a woman in her 80s from Western Sydney died at Royal Prince Alfred Hospital. And a man in his 80s from Western Sydney died at Westmead Hospital. He was a resident of the Hardy Guildford Aged Care Facility, and this is the fourth death linked to the outbreak. He had received 2 doses of the COVID vaccine and had underlying health conditions. A man in his 40s died at home in Western Sydney. That case has been referred to the coroner. That diagnosis was happened after death, and obviously we await the outcomes of those investigations. And there was a man in his 50s from Broken Hill, died at Broken Hill Base Hospital. So my key messages are to echo the Premier's words. It is really important that we continue to act responsibly to drive down those COVID infections. We are seeing pleasing declines, and that just shows with the combination of us trying to limit our social interactions, ensuring that we get vaccinated, that we can control the level of COVID. But it does require action by us all to hold the course, and hopefully we will see those numbers decrease in coming days to weeks.